All right, folks, welcome to our intro video for our trauma assessment playlist. So, as you can guess, this is all about trauma assessments. And what we are looking at right here is what we're going to, for now, just call our master trauma assessment algorithm. No, that's a mouthful. Maybe we'll work on that. But this is basically an overview of all of the things that we're going to cover and really what's a simplified trauma assessment and treatment algorithm. This is going to take basically all of the BLS and ALS trauma protocols and put them together into just a few easier to remember acronyms and corresponding algorithms that will allow us to much more easily and seamlessly move through a trauma assessment and treatment even under stressful and critical conditions. At least that's the goal. So we'll start off by covering March, and then we'll move into bleed and crush. Okay, so we'll start off by talking about March, because March is really at the center of this entire algorithm. March is an acronym for an algorithm, a trauma assessment algorithm that we'll go over in the next video, and it's really going to be the center of all of this. And what's cool about March is that it's actually an algorithm that can be used universally for any kind of trauma scenario. I mean, literally anything from I got my finger smashed in the sliding glass door all the way through the multi-gunshot, multi-stab wound or person crushed by machinery and anything in between. So that being said, we're always going to start with it because March is our primary assessment matrix, okay? So we're always going to start with March. And what's cool is, like when we do medical assessments, we always teach the ABCs, and we also teach that if the patient is unresponsive, we go CAB, circulation, airway, breathing, and if they are responsive, we go ABC, airway, breathing, circulation. You'll notice at the top of our algorithm here, we did start with checking the level of responsiveness. But what's cool about March is that it actually doesn't matter if they're responsive or not. We're still going to go in the same order, and we'll talk about that more in the next video. And we will also work off of March as our primary algorithm, okay? So this is our primary algorithm right here, and everything else that we do, we are working off of, okay? As we work down March, what we are looking for is signs of internal hemorrhage or external hemorrhage, any significant bleeds at all. And of course, the reason for this is that the reason patients decompensate and code in trauma settings, most of the time, 90% of the time, is bleeding. Sure, there's a few other reasons, and we'll address those later, but most of the time it's bleeds. All right, and so we're looking for any signs that there are significant bleeds, and then at that point, while we are still working our way down and accomplishing the March algorithm, we are simultaneously going to be able to branch off if we see a sign of a bleed and go over to this other acronym, and that is the acronym BLEED, and that's actually a really cool acronym, more on the ALS side for how we manage hemorrhage internally and externally by both mechanistic and pharmacological interventions. This acronym is really cool. We'll cover this in its own video as well. And so what you're going to find ultimately is that the majority of the stuff in the March algorithm is pretty much BLS. It's your meat and potatoes, if you will, of trauma care. And then the BLEED acronym really gets more into, it's some BLS stuff, but it's mostly an ALS algorithm for supplementing what we're doing in March to combat serious hemorrhage. And then lastly, you'll notice down here the crush injuries. And so crush injuries, of course, is their own category. They require their own interventions and pharmacological cocktails, if you will, and that will be covered in its own video as well. Again, that's like its own category, so if that's the present situation, it'll be obvious when you arrive at scene, but otherwise it's in its own category. So this is kind of just the general flow of the matrix here. Remember, it starts off with, again, March. Everything is March, and that is what we're working off of, and then we will branch off into these other categories based off of what we find and discover, okay? So that's how this works. It's really, really, really simple. And as we explore each of these elements individually in their own videos, it'll be even more obvious how they all work together. So let's rock and roll.